So continuing our discussion on PGI May 2013, ectopia lentis, where do we see? This is a very important question. Marfan's homocystinuria, wheel, Mercansoni and Ehlers-Danlos. But what is the challenge? Which is up, which is down, which is forward? That you need to know. Marfan is displaced upward temporarily because Marfan is a tall guy, he has to look up. I mean, we have to look up actually. Then homocystinuria, it is obviously downwards nasally. Well, Mercansoni, forward, you walk forward and fall into well. So, well Mercansoni is forward subluxation. Ehlers-Danlos, they have a subluxation along with blue sclera is what you have to basically remember. Then similarly, hyperlysinemia, ophthalmos, high myopia, intraocular tumors, uveitis, etc., etc. In all these scenarios, you are having the lens, ectopia lentis. Then what is a true statement about accommodation was a very important question. So, whenever accommodation occurs, there is an increase in anterior curvature and elasticity has a bearing. That is the reason after 40, loss of elasticity will lead to presbyopia due to the loss of the accommodation is what need to be remembered. Whatever accommodation that occur basically will not occur at the posterior surface, it occur in the increase in the curvature of the anterior surface is what I want to underscore to all of you. Then, what is the distance between the curvature of the anterior surface of the lens and that of the posterior surface? It is about 10 mm and that of the posterior surface is about 6 mm is what you need to, another important numerical. Then doctor, regarding ciliary body, just ask Suresh to check whether the video flow is smooth. Ciliary body, it has got a pars plana and pars plicata, and the contraction of the ciliary body will help obviously in accommodation, and ciliary body is the one which secretes the aqueous humor, that is also true. But where is the ciliary body basically located and what is the blood supply? There are 2 long posterior ciliary arteries and 7 anterior ciliary arteries. Clear? Please ask him to follow and then let me know. Yeah. So, 2 long posterior ciliary and 7 anterior ciliary arteries, from there the blood supply basically derives. And if you look at the ciliary body, it is about 1.5 mm posterior to the limbus. Examiner asked a question, is it 10 mm posterior? No, it is 1.5 mm posterior. That is the fix about the anatomy of the ciliary body. That's good. Coming to bacterial infections, which is a bacterial infection, hypopion ulcer. So what is hypopion corneal ulcer? It is a pyogenic organism like staphylococcus, streptococcus, gonococcus, marexella. They all lead to the formation of a hypopion is what need to be remembered. Then one of the options given was Moran's ulcer. What is that? Basically, if you look at the Moran's ulcer, it is also called rapidly progressive painful ulcerative keratitis. And what is the etiology of the Moran's ulcer? It is implicated to be due to hepatitis C virus. That's a modern school of thought. Hepatitis C virus ke wajah se. And without any infectious or systemic cause, then you call it as Moran's ulcer actually. But recent school of thought is, it is due to hepatitis C virus is what need to be basically remembered. Then what is the feature of a papilledema? Papilledema में आप फंडस लगा के देखे तो आपको दिखाएगा ऑप्टिक डिस्क एनलार्जमेंट, मगर पेशेंट के दिखावे में कुछ दिक्कत नहीं है, वो अच्छी तरह देख सकता. So the doctor sees, but and patient also see. Patient's vision is not affected. That is papilledema. What is optic neuritis? Optic neuritis, person will have visual loss. Patient cannot see. And if you look, in case of retrobulbar neuritis, you also cannot see anything. Retrobulbar neuritis may. So that is an example of retrobulbar neuritis may. Patient cannot see, doctor cannot see. Is it clear? Here's what you need to remember. Yeah.